My name is Dr. Phil Verhoef, and I'm an ICU physician. I support single-payer Medicare for all because I believe in healthcare equity. I believe all people deserve access to medical care, regardless of their employment status or their income or their pre-existing conditions. When I fought for a Level 1 adult trauma center here on the south side of Chicago, everyone said that providing trauma care would be too expensive because many of the residents on the south side are underinsured, or they're unemployed, or they're just plain poor, and they can't afford to pay for care when they have traumas or when they get sick. And of course that means the University of Chicago would have to eat the cost of that care. Well, we won that fight for a trauma center, but it is straining the institution. But what if we had a single-payer system that covered all healthcare expenses for everyone? Suddenly, doing the right thing for the community would be financially supported, and everyone would get the care that they deserve. Single payer is also equitable because it uses global budgeting to distribute resources. Primary care docs are some of our hardest working and important physicians, but they often barely make ends meet because our insurance systems reimburse primary care so much less than they do specialists. And what's more, Medicaid reimbursement is the worst, and so the physicians that care for our poorest patients receive the least amount of reimbursement. And that means that fewer and fewer doctors accept Medicaid insurance, and our poor have nobody to care for them. But with global budgets under a single-payer system, providers get the resources to provide the care for their patients, whether that's primary care or specialty care. And if you care for sicker patients, you get more resources. And it wouldn't matter if your patients were rich or poor. Ultimately, I support single payer because I believe it is the only approach to providing equitable care for all Americans.